Each Tuesday here on our program, it's of course brought to us by the Saddleback Memorial Medical Foundation and the hospital here in our community, and we always have a guest or two joining us from them to talk about some of the good things they feature over there. Two guests joining us today, one of the physicians on staff, Dr. Tanya Evans, a dermatologist. Welcome, Dr. Evans.
Thank you.
Good to have you with us. And Phyllis Abate, who is a foundation board member and also a patient of Dr. Evans. How conveniently coincidental.
Isn't that nice?
Nice to have you both on the program
Thank
today.
you.
Well, obviously, dermatologists, we want to talk about the skin and problems we can have with the skin. You know, we keep hearing sun damage, skin cancer, no, bad, sunscreen, good, you know, all these things. Let's talk about that. Is that the main cause of skin problems these days, is overexposure to the sun?
Yes. Actually, in 2008, the statistics were that 1 in 5 people will develop skin cancers in their lifetime. And the most common types of skin cancers are, of course, basal cells and squamous cells, and they are sun-related. And even melanoma can be sun-related, also, although there is a genetic component to that. But most of our problems are due to the sun.
Okay. Here in California, obviously, that's, you know, I mean, the Beach Boys and all, you know, California sun, go to the beach, everybody goes, oh, it's summertime, let's get outside. I understand there's a little bit of sun benefit for a few minutes a day, but too much is becoming problematic.
Correct. They've even shown that 15 minutes of unprotected sun exposure can cause some cell death, actually. It is important to be out in the sun in terms of the vitamin D. There is controversy towards that, however. The recommendation is about 5 to 10 minutes each day, but even with that, even with some protection, it's not 100%. So we do get enough sunshine out there, but most of the vitamin D deficiency that we've been finding, it's due to not enough intake of vitamin D.
So dietary as opposed to sun exposure.
Correct.
Right. I understand besides the sun, there's some other things that can lead to skin cancer and skin problems, perhaps something that's been prescribed even by our doctor.
Well, there are some medications that can make you more sensitive to the sun,
Okay.
of course, such as high blood pressure medications, some cholesterol-lowering agents. So it's important to know to protect yourself a little bit more when you're out there.
Mm-hmm. Phyllis, let's talk a little bit about that. I know you're a patient of Dr. Evans. You know, California, we all want to look good and be outside and be healthy.
Yeah.
It's a trade-off, isn't it?
Oh, it's a big trade-off. I mean, Dr. Evans has been my doctor for, gosh, going on 5 years. And I go in annually. I'm a good patient as far as showing up for appointments and doing everything. And I listen to everything that she tells me. And she's right in everything that she does, but I love the sun. And so Dr. Evans has been educating me on, if you're going to use sunblock, what's really important, how much. I thought it would be a good idea because so many of our residents, we all play. We're out in the pools and tennis courts and golf courses and things.
Sure.
So we're going to listen. And
Okay.
we're going to pay attention.
Let's talk about that, because I think one of the big mysteries is the numbers. You see that SPF number on the container. It's a 50 or a 15 or a 25 or whatever it might be. Does that make a huge difference, or is it more important that we just use it?
It does to a certain extent. They've shown that even SPF 15, if you're reapplying every hour and a half, and if you're applying enough of it, can protect you. However, I do recommend an SPF of 30 and above. And it's a good idea to apply about a shot glass amount, which is 1.5 ounces, to sun-exposed areas, the face, neck, arms, décolleté or upper chest area.
One thing I've heard is also you should apply it at least 30 minutes before going outside to let
Correct.
it kind of absorb into the skin, correct?
Correct.
All right.
Yeah.
I know we're all familiar with the old and maybe not so old shots of the lifeguard at Newport Beach in his red trunks and the white zinc oxide on his nose. Is that an effective sunscreen?
Zinc oxide and titanium oxide are your physical blockers. So they're like your shields, and they do protect against UVA and UVB. And of course we have the chemical blockers. Chemical blockers are a little bit more finicky. The physical blockers you can count on a little bit more for both UVA and B. There are some newer ones out there like Maxeril and Helioplex that also protect against UVA and UVB.
Some people have very sensitive skin to, you know, soap practically. Are there certain folks who have allergies to sunblock?
Yes, mostly the chemical blockers. We do see allergies with avobenzone and oxybenzone, which are the more common ingredients in chemical blockers. The physical blockers are a little bit more tolerated by patients who have allergies.
Okay. And especially those of us that are a little bit follically challenged, they always say wear a hat, not just a baseball cap, but a broad brim hat, sort of like almost like a farm worker, or again, that big lifeguard straw hat is kind of what a lot of people are suggesting for men and women, really.
Yeah, sunblock is not 100%, and it's important to know, and even waterproof sunblocks are not 100%. So it's a good idea to go into a fight with the most amount of protection that you can.
Okay, be well protected, be well armed
Right.
for the battle against the sun. Supposing that we do find something, that you find something on an examination, depending on what you find, I guess depends on the procedures that you would use.
Correct. Most of the time, people will come in with a non-healing sore or something that's been there a long time that hasn't gone away. And it's a good idea to check it because it's really important to catch skin cancer early. Skin cancer is treatable, and if it's caught early, it also can be treated with creams versus doing more extensive procedures.
Obviously, if something needs to be removed, you usually send it out to have it looked at, make sure there's no cancer cells involved, but let's hopefully that you catch everybody's skin conditions before it gets to that point.
Correct.
Very good. Well, Phyllis, I know it's very exciting to be a part of the hospital foundation and work with the hospital. And obviously, doctors like Dr. Evans provide great care, but we also need a great facility like the hospital to provide that care.
Thank you. We appreciate that. We were thrilled that Dr. Evans would join us this morning. And she's part of the community, and Saddleback's part of the community, and we just want to be able there to support one another.
Dr. Evans, is there other things that can affect our skin? We talked about maybe medications and overexposure. Are there things we can do on a positive side besides the sunscreens, say the kind of foods we might want to eat?
Sure. There are a lot of antioxidants out there that are important, like green tea and dark leafy vegetables and dark fruits, dark berries. They protect you against the oxidative damage from the sun. And not only are they good for the skin, but they're also good for our entire body.
All right, very good. So if people have questions, they can come see you, and especially if they have that unusual bump or bruise or something on their hand. Let's talk about bruising if we can for a minute. I know a lot of folks, especially as we get older, they say our skin gets thinner and people tend to maybe bruise easier. Is that just a common thing that comes with aging, or is there a medical problem potentially behind all of that?
I think it's a combination of that, as well as sometimes medications that we take that may thin the blood. Some people are on blood thinners, and also some over-the-counter medications like vitamin E, garlic, niacin can thin the blood. So it can cause increased bruising. And there are things that we can use. Topical vitamin K and topical vitamin C help us in diminishing the bruising effect.
You have a wide-ranging dermatology practice. Not only do you deal with things like skin cancer and bruising, but you also deal with some of the cosmetic aspects as well, I understand, in your practice.
Correct.
These are becoming more popular, I understand, these days.
Yes, and I think more so for just people wanting to look healthier, not necessarily more for cosmetic reasons, but it's kind of like having our body's like a car, and it's just a matter of maintaining it.
It's a good analogy. I think a lot of us guys spend more time on our cars than our bodies, but that's a whole other story. Doctor, thank you for joining us today. Dr. Tanya Evans, our guest today, dermatologist, and Phyllis Abate, a member of the Saddleback Memorial Foundation, and also one of her patients. Good to have you both on the show today. Thank you.
Thank you.
Thanks.
We'll be coming right back with more as our program continues today, right here on Channel 6.
The civic-minded citizens and physicians who planned Saddleback Hospital envisioned a full-service, high-tech hospital.
The medical center is a state-of-the-art facility that continually upgrades to remain state-of-the-art.
Our success is a highly skilled, diverse, and caring staff who meets all of your healthcare needs.
We represent virtually all medical specialties, and we practice in close proximity to you, our patients.
Saddleback Memorial Medical Center, keeping the village healthy since 1974.